Good evening, everyone. My name is David, and welcome to another of ACPP's webinars and the continuation of a regular set of professional development opportunities the college will be running. Before we begin, I'd like to acknowledge the traditional custodians of the lands where my Australian-based colleagues are located today and pay my respects to their elders past, present, and emerging, for they hold the memories, traditions, cultures, and hopes of Aboriginal and Torres Strait Islander people of Australia. In recognition that we are a binational college, I would also like to take this opportunity to acknowledge the Maori as Tangata Whanaua and the Treaty of Waitangi partners in Aotearoa, New Zealand. This evening, I have the pleasure to introduce you to our guest speaker, Paramedic Greg Hallam. Greg is a paramedic who's currently working from Grampians Health Stawell in Victoria and currently works as the Clinical Emergency Manager Project Officer responsible for the policies and procedures of emergency clinical staff. Greg has a long history as a paramedic, which includes 23 years working for Ambulance Victoria, where he held the positions of Advanced Life Support Paramedic, Team Manager, Regional Reliever, Health and Safety Rep and Union Official, and he also upwardly relieved in a number of senior positions and management roles. Greg moved away from Ambulance in 2021 and became a COVID-19 vaccinator for Grampians Health Stawell before becoming an urgent care centre paramedic at Stawell Hospital. Greg's responsibilities in urgent care were triaging and streamlining patient care and initiating emergency treatment, and he'll speak to more of that shortly. Today, Greg will be discussing his various roles within Grampians Health Stawell and the benefit of the wider paramedic integration into traditional healthcare teams. At the end of the presentation, there will be a short Q&A. If you have any questions, please feel free to write them down into the comments section, and I'll go through them in the order that they appear. Without any further delay, I'd like to pass the webinar on to Greg. Thanks, Greg.
Thanks, David. Hi, everyone. As David said, my name's Greg. Just like to take a bit of the opportunity tonight to talk to everyone about my experience from going from being an ambulance paramedic into working into the public health system. In October of last year, I was lucky enough under surge to actually get a job as a COVID-19 vaccinator at Stawell Hospital. The transition into this role, even though the skills were basic, was a lot of theory and training to skill up onto the way that hospitals all of a sudden managed anaphylaxis and also gave their medications, in particular the COVID-19 vaccinations. After a couple of weeks after starting work in the COVID clinic, I was actually asked to go out and start COVID swabbing, which is something I hadn't signed up for, but something I look forward to doing regardless. So that all happened around the start of October. Towards the end of October, I was actually asked by management to start having a look at a program that they had built in theory but hadn't actually put into practice, and that was a process called COVID at Home, which was the management of all COVID positive patients through various pathways to keep them out of hospitals, to stop ambulances attending, and also to keep the community safe and give them access to a level of care that hadn't actually been anyone had been thought to. So in October, end of October, I started rewriting policies and streamlining the way that we actually looked after those patients, continued to vaccinate and also continued to swab. And then in early December, we started to get a peak in the last big wave of COVID. We've all of a sudden started seeing 100 plus patients a day coming through the COVID at Home, thousands of people lining up for PCR swabbing on a weekly basis. So the days become very hectic. And then in January, as part of the surge workforce capability, I was then asked to become the paramedic working out of the urgent care facility for a period of 3 months, on top of all the other roles that I was actually doing at the hospital as well. So being a paramedic in that setting brought a unique skill set that hospitals, I think, are still struggling and underutilising it at this point in time. On the 28th of March this year, that saw my formal transition out of the COVID space into the project management space, where I'm working on clinical and emergency management policies and procedures. But with COVID, I'm still heavily involved with COVID. Once again, being a paramedic is brought into a different roles into the hospital. So even up until 2 weeks ago, I was brought into outside nursing home agencies to do rapid clinical assessments on all their positive patients, so we could actually start their antiviral treatment. So far it's been over the last 10 months, a very, very busy and rewarding time through that period. So as I being the paramedic at the hospital, it put me into a unique environment where I actually brought had the clinical skills that they were actually needing and looking for in their workforce. The slide actually shows it's a poor photo, but that's black car in the background is actually 1.5 kilometres away through the zigzag of traffic for lining up for daily swabbing. So even though we were out swabbing on a daily basis in the mornings, we're actually assessing and treating patients as well, trying to get them into pathways if they're clearly showing signs of respiratory distress or having any issues. The COVID at home program, so far we've actually seen over 1,300 patients who have actually come through our program. The program now consists of a monitoring system that's actually all managed by the state, which is streamlined workloads and made things a lot easier to deal with. We've also we also conduct all the intake assessments on the positive patients who have come through our pathways, ensuring that each of them have the medical advice given to them, full clinical assessments over the phone, and also usage of their antivirals that we tap into their normal GP support networks to organise. We also look at building relationships or putting the patients through further pathways of a heavy reliance at the moment of the Victorian virtual ED department, or also out this way as well. We use My Emergency Doctor just so we can streamline those patients into getting advanced care for respiratory support. So that way we've been very lucky. I've also spent many hours outside the hospital in nursing homes, providing a clinical skill set to do rapid assessments. I've been sitting in patients' homes over the last couple of months, waiting for ambulances to arrive to actually take those patients off to hospital. So being that paramedic in a hospital's, it's been quite productive at this stage to actually offer those skill sets. We're still dealing with outbreak management. Most of you will be preparing as well for the upcoming wave that we're just starting to see the upward incline now of the wave, and hopefully in about 4 weeks' time when that peaks, it'll roll on, and so the workload, unfortunately for everyone's going to probably get a little bit busier over that period of time. Having the experience that I have had, I've become the subject matter expert at Stawell Hospital in regards to COVID. I work with a really good team. We don't have any nurses on our team. Sorry, should I say we don't have any registered nurses on our team. The pandemic manager is a OT by trade. I sit there as a little bit of support and governance. And then at this stage, we have enrolled nurses to help do the intakes. So it's a quite unique and interesting environment to get outside of where everyone is actually trained to the same level, and then go into an organisation where everyone has so different amount of skill sets that we all still work together as a productive team. The big challenge for me at the start of the year was actually fitting into the role as the urgent care paramedic. Obviously, I've been a little bit vocal within Grampians Health over this. Being a paramedic in urgent care brings so many added benefits that the traditional health model just does not realise that there is a unique skill set that we can actually bring and pay benefit to hospitals, regardless of whatever size, to assist doctors in advanced airway management for reduction of skeletal fractures, to help junior nursing staff triage and rapid package patients to actually get them out of the hospital. They've all been key highlights that I've actually done over the last 3 months. So it's been really good in that setting. Plus, too, for me, it's a good way of keeping up my own paramedic skills. The limitations that I actually had working out of the urgent care centre was just the fact that, unfortunately, Victorian state law doesn't allow for any medication administration. So for that, there was actually, even though we could treat rapidly, there was delays in medication being sought by doctors and getting it prescribed over the phone and so forth. But overall, it was a unique skill set and a thoroughly enjoyable time. So currently we've started a large project at Stawell Hospital, looking at the way our urgent care facility actually works. So we've started this project, and it's only just in its infancy. It'll probably go for the next 10 months, but we're now trying to rearrange an urgent care facility that sees just over 4,000 patients a year through its doors, to really reflect what the external stakeholders actually expect from us. So what patients expect from us, what our staff expect from us, and also how we can actually hand over to the external stakeholders, such as ambulance or Adult Retrieval Victoria or Piper. So it's a large piece of work that we're actually now taking on. Part of that role will actually be workforce planning as well. So we're looking at changing subtle little changes at the moment. So looking at medical assistant technicians, so changing our admin staff to also have a bit of a clinical role, looking at capabilities within the hospital, and just little things, reflecting treatment and medication policies to the patients who are being transferred out to actually have the same presentation of medication in the same format that they required to be transported out. So hopefully doing away with 100 ml bags of heparin, for example, and going into a 50 or a 60 ml syringe for transport out in a syringe pump. So that's key to progressing and going forward. The other big thing is, is there a role for paramedics within urgent cares? Yes, there is. So are we allowed to work in urgent cares currently in Victoria? Unfortunately, after the surge workforce finishes, then that will actually decline again. Now special authorities will probably go. But it's been good. There is space and there is talk and discussions at the moment occurring around how that can actually happen. How can the paramedic work within a hospital and actually give those skills to hospitals. So I think in the long term, the way forward for us will actually probably be having a mixture. At the moment, our urgent care facility staffed by one nurse 24/7 and an admin staff member that does about 12 hours a day. So the model going forward, and this is where the project has a broad scope to look at, might look at an RN plus a paramedic plus a medical assistant technician actually working in that space for the 4,000 patients a year. But that would be on a 24/7 model. So there's a lot of space to develop going forward. Hospitals are interested. I think paramedics are actually interested. It's a good transition to retirement, leaving especially ambulance and actually stepping into another role that you can still use use your skill set, still enjoy absolutely everything that you do. I personally like the fact that now at 4:30 each day, I'm out the door. I like that very much. So the future is basically ours. We just need to gain foothold, and that's what I'm hoping that this project can actually explain to our internal stakeholders. And now that Stawell Hospital is part of Grampians Health, and we span from Ballarat, Edenhope, Horsham and Stawell, and also Dimboola, that we can actually spread our work policies and procedures to offer the best care that we can, and that obviously involves unique skill sets that paramedics can actually offer as well. So what's the future bring? Yeah, there's a lot of potential out there, especially in the public hospital setting, that we can actually provide further care, further skill set, and really assist the medical and the nursing staff to actually in traditional healthcare setting to actually improve and become better for the patient. To have is part of the solution. And I know that ramping is an issue all over the place, but actually having paramedics in emergency departments to hand over from ambulance paramedics to actually look after those patients with the same scope and skills and everything until beds actually become available. It frees ambulances to go out. So there's those options. Can we actually use paramedics for more community-based work? So utilising paramedics in the traditional district nursing models, there's that potential as well. So I think over the years, it's that the role as the registered paramedic has only got scope to grow and get bigger. So, sorry, Dave, I'm starting to run out.
Oh, that's perfect, mate. I was just jumping on. You can see you're reaching your last slide. Thank you very much for that, Greg. That was really interesting. If anyone who's also chimed into the live recording here, feel free to just go and pop some questions in the comments if you'd like. But Greg, I might just start off, if you don't mind, and I'm really interested in the nuances. So Stawell is a rural town. Did you say before it was about 230 odd Ks from Melbourne, for those who don't know? Is that right?
Yeah, so Stawell's got a population of 6,500 people. We're 125 kilometres to the west of Ballarat, and really about 230 Ks from Melbourne. So really about a 3-hour drive time if you wanted to.
Mm. So considering the rural challenges, I guess the challenges that a rural setting provides, and I'm also aware that Stawell has got quite a large foot race each year, the Stawell Gift around Easter time, so I presume your population swells over that period of time uniquely as well. But I was interested to know what's advantage. We've been talking about the paramedics in the urgent care centre and the value that provides, but I'm also interested to discuss and hear your thoughts on what a prescribing paramedic practitioner might be able to play in not only the hospital setting, but also perhaps in support of the primary care that you provide within Stawell. Do you think that there is a benefit for quite a senior and experienced paramedic with prescribing authority might be able to integrate into the setting at Stawell?
Yeah, very, very much so. And I don't think it's just Stawell. I think it's right across the whole of Western Victoria. It will probably go right across Australia. There is a unique hole there at the moment. Smaller communities can't get doctors. The ability to actually find nurse practitioners are actually getting harder and harder to find. And it makes no difference if you're a nurse practitioner or a locum GP and you're getting paid X amount of dollars and you can earn that money living, working 50 minutes from home or working 4 hours. The option would always be you're going to work closer to home. So we're really, really struggling over my time here in Stawell, and I've lived back here for over 20 plus years. We've gone from having 10 plus doctors now down to having about 6. So we've noticed that we're struggling. So basically, we've gone from 3 GPs practices down to 2. It's harder to find nurse practitioners and doctors after hours or available to do weekends as well. So the challenge for the public hospital system is a greater reliance then on the virtual EDs around the place, a greater reliance then of transporting patients out of Stawell, out of Edenhope, out of Warrnambool to another hospital that can actually cater for those. So prescribing paramedics would be very beneficial. They would fill that role quite nicely. And even when you're looking at urgent care workflows, to have someone with that skill set who can actually bring someone in, treat them quickly, package them up and get them out of the facility as quick as they can, the patient gets better experience, the staff feel more rewarded. So there's a lot more positives to it. We just need some of the changes to be enacted in Parliament, basically.
Yeah, the legislative changes are the key there, and that's a really interesting space that we're working in, and I know there's a lot of movement in that space as well, and with any luck, the future is quite bright with that. We do have a point, just a comment here, and I guess that the question is asking about, has this model been tried anywhere else in the state? Is there anything happening around the major rural towns, Bendigo being one, Ballarat a bit closer to you, Warrnambool? Do you know of any other paramedics who've been surged into urgent care centres or emergency departments?
No, not that I was aware of. So I did try to find out through our management structure at the hospital, and they couldn't actually tell me. But all I know is that I was the only one within Grampians Health that actually was appointed. So which was good, but at the same time, there's space. And even though I'm not working in the current clinical space as a paramedic in the urgent care, if I walk through there and they have a challenging patient, I'm always being asked to stop just to wait there, just in case anything actually happened to that patient to deteriorate. So no doubt there's other parts of the state where hopefully people can. I know that the Sunraysia Community Health Centre has actually just recently appointed a community paramedic based out of Swan Hill, I believe. So that's the only other position I've heard of, but not working in acute health.
Yeah, no, exactly. And I think it's an interesting space. I do know of some paramedics in Western Australia and other places that have been surged into EDs, and so the word is getting out there, and I think that systems are seeing the benefit of the paramedic. And I might just lean, my last question here, I might just lean into your COVID experience too, which is quite thorough, especially over the major waves happening in Victoria in recent times. What role do you feel that paramedics might be able to play in healthcare teams moving forward, specifically with regards to COVID? So you've enacted and been involved in interesting surge teams. We're probably moving into an endemic phase of COVID-19 soon, if we're not already there yet. And I guess the question is centered around the paramedic role within integrated care teams, specifically designed around COVID moving forward. This is a virus we're going to be living with forever, essentially, as much as I can see. What are your thoughts there? Do you think that not just involved in hospitals, but in community responses and primary care?
I think that there's a very good position for us in traditional healthcare model. Paramedics just don't get mentioned. We're seen outside of the hospital. So as soon as something like COVID comes up and they start formulating a team and a process around it, it makes all the components are there from the traditional healthcare care model. And when you turn around and say, well, there's another part of the workforce that they're paramedics and they can step in, they bring a clinical skill set, they have an understanding of all the pathophysiology, they can go out and assess these patients quickly, they can make a very quick triage diagnosis of whether or not this patient needs to go to the hospital or are they safe to stay. It's the key bread and butter that we actually do. So we don't need to bring nurses out of A&E departments or cath labs or whatever other department from the hospital that they're pulling resources out to form a COVID team. Paramedics can quite easily step into those roles as well. Talking about prescribing rights and bringing that on board. So nurse practitioners can authorise the antivirals. So wouldn't it be great if paramedic practitioners could also authorise the antivirals as well? So you can have a patient who's actually had an intake assessment, paramedic practitioner could pop out to the house, assess the patient. Yes, they do need antivirals. Here you go, or do it via what we're doing at the moment and do it virtually. So, you know, there is a unique skill set that we can bring and we can take it from there. I don't know how many conversations, even just recently, where people have said, "Oh, these patients are really unwell and they're struggling." And when you ring them up and have a chat to them, they're talking 4,000 words a minute. They're not stopping to take a breath. There's no respiratory distress or anything, and that's just from our experience and knowledge that we actually bring. We can actually listen to that and determine fairly quickly how sick someone actually is. So there is a big scope where paramedics can step into those teams.
Well, thank you very much, Greg, for your time today. I really appreciate it. You're really breaking some ground here in Stawell, and it's really exciting to see opportunities exist for you, and hopefully that goes and moves forward to other opportunities for other paramedics in other rural and metropolitan settings in unique spaces. The role of the paramedic is nuanced and certainly adds benefit to a range of healthcare teams, and I think you're proving that at the moment in Stawell, and well done.
Yep, thank you.
Thank you very much, everyone, for joining us today, and have a good night.